In a world where diseases and illnesses are skyrocketing, many struggle to find hope for their well being. Having very few options to turn to, they resort to a system of greed where financial growth is prioritized over the dwindling health of patients all across the nation. With the unknown telling of where and when patients will be able to receive treatment is a concern for many as they hold on to their very last dose of relief. Accessibility and innovation would be a dream as life threatening remedies come at a cost that many can find difficult to justify. What is causing this strain, and what does it signify for the people whose survival relies on these essential treatments? It is by no surprise that the rising cost of drugs is becoming a major epidemic in the United States, leaving citizens worried and hopeless for not only their health, but the country as a whole. A recent analysis by the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services shows that the average price for roughly 2,000 medications between 2022 and 2023 was 15.2% higher than the rate of general inflation, and more than three times the increase from the prior year, according to Krishnamurthy and Perk 2024. Many of these drugs come at a prohibitive cost, however, others include a price tag that is nearly impossible for any patient to pay for. With a one-time cost of $2.1 million for a course of therapy, Zolgensma continues to be the most costly medication in the United States, according to McQueen 2022. While a great number of factors come into play when it comes to these skyrocketing prices, experts believe that drug prices typically grow as a result of increased research and development costs, according to the National Center for Biotechnology Information in 2017. With the rapid growth in drug prices, many patients have resorted to medical cannabis to treat diseases such as Crohn's disease, glaucoma, and multiple sclerosis, according to Mayo Clinic in 2021. Although this may sound like the perfect solution to this epidemic, the use of cannabis is still prohibited in numerous states, according to DISA 2024. Candice Sigala, a healthcare worker in the cannabis industry, says that so many of my patients come into my clinic with diseases due to the fact that their insurance doesn't cover enough their medication, or they just simply can't afford healthcare. It breaks my heart all the time because I've become so close to these people, and it's just ridiculous how people can't even gain access to basic things like medication. Affordability is a greater problem for individuals who are taking four or more prescription medications, even though around two-thirds of adults think it is very or somewhat easy to pay for their prescription drug prices, according to Sparks, Gorinsger, Montero, Valdez, and Hamill 2024. When it comes to mental illnesses like anxiety, depression, schizophrenia, and bipolar disorder, many patients rely on drugs like citalopram, fluentexol, and lorazepam for symptom relief, according to Rethink Mental Illness. Psychologist Victoria Corpitz mentions that as a healthcare worker in psychology, I am faced with many struggles on a daily basis, with one of the main ones being the heartaches I endure while seeing the pain and suffering in my patients' eyes. I do as much as I can to ensure their well-being, but words can only help so much when the case is so severe. They rely heavily on pharmaceutical drugs just to get through the day, and I believe the rising cost of drugs in America is what's stopping a lot of people from getting the help they not only deserve, but desperately need. Even while regular psychiatrist visits and counseling can help manage many forms of mental illness, people who require medication but cannot afford the pills may have severe symptoms. National Alliance on Mental Illnesses article titled About Mental Health Conditions mentions that untreated mental health conditions can result in unnecessary disability, unemployment, substance abuse, homelessness, inappropriate incarceration, suicide, and poor quality of life. Additionally, patients with severe oral diseases and illnesses may require strong pain medication, such as hydrocodone, oxycodone, and acetaminophen with codeine, according to the National Institute of Dental and Craniofacial Research. Due to the rising cost of drugs in America, many patients find it difficult to obtain these treatments. According to Carolyn Clark, a medical expert in the oral surgery industry, patients who are uninsured should have some sort of discount for the pain medication they're prescribed, since a lot of oral diseases are out of their control. The most common disease I see is tooth abscess, and is so painful that the only successful relief options are drugs like oxycodone and hydrocodone. They oftentimes will try to use ibuprofen to relieve the pain since their insurance doesn't cover them, but most of the time it is just not strong enough. Although America may not see a significant decrease in drug prices anytime soon, solutions to reduce the cost for patients still remain. To combat some of these high costs of drugs, patients can ask about a Medicare prescription payment plan, use pharmaceutical assistance programs, and think about even moving to generic or less expensive medications, according to Medicare. It is without a doubt that the rising cost of drugs have negatively impacted the lives of many patients suffering from a wide range of diseases and illnesses. Oral problems, life-threatening diseases, and mental health conditions all significantly contribute to the rise of drugs for alleviation. Many experts and healthcare professionals have testified to this ongoing financial battle. However, studies have indicated that cost-cutting measures may be effective. When will this struggle end? Only time will tell.